Summer is also a peak time for certain health problems, especially connected with insects. To share some advice is the founder of Redcross Personalized Medicine, Dr. Ken Redcross. Thank you very much for being with us,
Thank you so much, Chris, for having me.
First of all, I know these kinds of bugs, this is not bacteria, but in some cases this can be pretty serious.
Well, actually, in this case, we're talking about Lyme's disease, which actually can transmit that bacteria to us. Borrelia burgdorferi is the name, but we're not going to worry about the name. We're going to focus instead on how to avoid it.
And of course, the other bugs we're talking about are the insects. Lyme disease comes from ticks.
Yes, yes.
So how do people get these?
Well, because ticks are actually the vector, and usually they come from either deer or rodent, and we're out in the brush enjoying our summertime. Usually the peak time is between April and July. That's our peak time, and so we're out and about, and when we do that, we're obviously exposing ourselves.
Well, you don't have to go deep into the wilderness to have this problem. I guess, what's the advice? Like, let's say you're going to Franklin Park or the Arnold Arboretum. I mean, what should people be doing?
No, that's a good point. So, Chris, the point is you want to make sure that you're covering up, right? You want to make sure that you're wearing long pants, that you're wearing long sleeves, and if you're going to wear shoes, they need to be closed, and you want to make sure that you're tucking your pants into those shoes as well. The other thing is you also want to think about clothes that are white or lighter. Because that way you can at least see the ticks on your body. So it's very important that you do that. So if you're going to go to those areas, you want to make sure that you're at least practicing some barrier precautions in a sense.
Well, just because you have a tick sucking your blood doesn't mean you're necessarily going to get Lyme disease. But what should people be looking for? Because if you wait too long, I guess it could get a lot worse, right?
Yeah, it can. You know, it takes about 24 hours or so for the tick to be on your skin and really infect you. You know, what they're doing is they're getting latched into you, they're regurgitating, and when they're doing that, they're maybe potentially injecting that bacteria. I even had a few sesame seeds here just to show, Chris, what these ticks can look like, how small they can be. So it's not easy to always pick them up, but you want to make sure that if you see them on your skin that you get them removed immediately.
Well, you have some other things here. Is there anything that helps deal with the bite once you've already had it?
Well, there's a couple of things here. So on the prevention side, Chris, what I brought here, I have eucalyptus, citronella, tea tree oil. You see the witch hazel, apple cider vinegar, and a spray bottle, because that's a nice kind of natural way to create a bug repellent. We talked a little bit about trying to avoid anything that's a carcinogen. Well, this is like better to kind of Mother Nature, the way to keep bugs off of us.
So, in other words, if you're out and you're wearing shorts, definitely cover any exposed skin with this kind of material?
Oh, absolutely, Chris. That's the important part. The other thing is, too, you want to make sure that you have maybe a kit like this. This kit I actually got off of Amazon. It's a diagnostic tick testing kit. And that way, if you find the tick, you put it in a little plastic bag and you're able to mail it off and find out if that particular tick actually did have Lyme's or not.
And I guess the other thing, too, is about mosquitoes. So what can you do? Because a lot more of us are exposed to that. You don't have to go very far. How do you keep them away?
Well, you know, luckily this is something that can be very beneficial for them as well. If you're going to sleep out, if you're out and about, you want to have a net, that sort of thing. It's very important for mosquitoes. They do that a lot in other countries as well. So it's important that you're not only practicing just spraying that on your skin, but also making sure that your space is also covered.
Of course, the other advice here is about when you go out and what you do, because most of the day in the summer you don't hear or see mosquitoes, but there's a certain time where they're everywhere.
Yeah, and mosquitoes can be very devastating. In fact, in certain areas over in Florida, they're spraying the whole cities to make sure that they're keeping the mosquito population down. That's another thing that's interesting about the tick population. We're starting to see that the tick population is growing, and it's because of the warmth that we're getting in our environments now, right? So therefore, the tick season is going a little bit further. But luckily, there are some things that we can do. Antibiotics are beneficial when you're talking about Lyme's disease, okay? Doxycycline in particular, amoxicillin can be used also. But one of the things that's very difficult for me, Chris, is that I have patients who have already been treated, but they still feel the fatigue. They still feel the joint pain. So that's why it's important for us to focus on the immune system when we're talking about how to kind of manage those post-Lyme symptoms.
So what about that immune system help? Anything you can recommend?
Yeah, you know, one of the better things, I have a medicinal mushroom here. It's called AHCC. I like talking about it because it has data behind it. In fact, some of the institutions here in Boston have already done studies on them, Harvard, Yale, and found out that it has a robust effect on boosting our immune system. It increases what's called natural killer cells, and they're important to help boost our immune system. Now, not only is AHCC important, but you see here that I also have vitamin D. And I'm sure you've been hearing a lot in the news
it's supposed to be good for you, for a lot of things, right?
For everything. But the point is, it's actually true. Vitamin D is very very beneficial, not only for our bone health, but also for our immune system and our mood. And our mood is important when you have someone who's dealing with chronic Lyme's and having such a challenge. It's very, very difficult.
This has been a news, and we're talking with Dr. Ken Redcross from Redcross Personalized Medicine. Doctor, I guess another thing that strikes me here is that when people are bothered by an insect bite, they think that's a small thing. You don't go to an emergency room. You don't pester your doctor about that. But actually, sometimes you need to pester. What's the best way to do that?
I like your choice of pester because you're right, these are pests. But yes, take it seriously, everyone, because Lyme disease can be very debilitating, right? One thing you want to look for is you want to look for that rash. We call it a bullseye rash. That's probably our first sign to know, like, you could have been infected with that. Now, the other challenge is the blood tests that we have for Lyme's, not that great. They can give you a lot of false negatives, meaning you could have Lyme's, but it won't be positive for a month or so. So we need to be careful about that.
Of course, the reason I asked you about that pestering is that people need a better rapport with a doctor. You wrote a book about that. So what's the ingredient here?
I did. So the name of my book is Bond. It's the importance about the patient-doctor relationship or the bond. It's important that you focus on those things that I talk about: trust, respect, empathy, and more importantly, Chris, communication. I think all of those things are so important because your doctor should feel like a member of your family, because I'm convinced when you feel that way, Chris, the healthcare outcomes are so much better.
Now, another summertime concern for many people, maybe many more people, is connected with air quality. If you've got asthma, if you maybe have hypertension, people should be on the lookout, right?
Yeah, it's a good point. And it's important, especially in our big cities. So I'm in New York City. Here you are here in Boston, and I used to have a practice in Los Angeles. So I think I've hit the poor air quality capitals of the world. And it's important that we do take them seriously. It increases our risk for flare-ups, for asthma, also for COPD. If you have emphysema, if you're a smoker or even former smoker, have to be careful with the air quality there. And they do have some good air purifiers out now too.
Well, thank you very much for being with us.
Thank you so much for having me, Chris. I appreciate it.